welcome everyone. This is Spring Pharmacy, and we bring to you always the best. You always can find us on Wilson Street, and doing that, we are the pharmacy with hard to find medicines. Now, specifically, there are a lot of things that we handle in and deal in, and the thing I'm highlighting mainly here is supplements. Most of us have gotten in touch to know what our serostatus is, and most times when you talk about serostatus, people look for HIV. Is it positive? Is it negative? But then, as a man, and men mainly, have you asked yourself about what is the status of your prostate? Because most times when you look at other things, we leave out the things that sometimes affect our health in later ages. So the thing I'm talking about here today is prostate, and more so if you know prostate, it's very important in a man in that it helps to regulate a few functions. Your semen comes through the prostate that fills it with a fluid that is able to perform the functions it is supposed to do. So many times we forget about that. We only look at, do I have pressure? Do I have diabetes? Do I have HIV? And most people are sure about that serostatus, but how about the health of your prostate? Now, in most cases, the prostate has its functions in producing a fluid that fills up with the semen, and then it helps the semen also to give that fluid and help it swim, and then fertilization occurs, and then later a human being comes up. So it has a very, very, very important function. So we forget about it, yet it's rising of recent. So we have mainly three common infections or common disorders that comes when we are looking at the prostate gland. We have prostatitis, which is inflammation of the prostate gland through infections, through other risk factors that we may overlook, but then with time it comes. So we have prostatitis, which is inflammation. We have BPH, which is benign prostatic hyperplasia, and then we have prostate cancer, of which the main common one among all these is BPH. And it's more common. Now, when we say benign, it is something that is non-cancerous. Let no one scare you that it's cancerous. Let no one push you away and tell you this thing can kill you. No, it's non-cancerous. Only that it doesn't spread. It is an enlarged size of the prostate, so it enlarges. Now, there are a few things that when it enlarges, it obstructs the urethra, and then it pushes the bladder against. So there is that pain while urinating. There is sometimes it even reaches a point of blood in urine. Sometimes there is frequent urination. Someone wants to urinate frequently because the bladder is squeezed, and when it is squeezed, it doesn't hold urine for long. So we have all those other symptoms that we shall list for you in a few pages, and then you'll read through. But the main thing that we are looking at is how do we prevent this? We all know that prevention is better than cure. And in most cases, how are we preventing it? Now, the question most people ask is, are supplements going to treat? And the answer to that is supplements don't treat, they prevent. The body needs minerals. For example, the prostate mainly works mostly on zinc. So when studies have shown that there are high levels of zinc in the prostate gland, and there's also others like calcium, there's also others like magnesium in the same prostate gland that helps it to carry out its function. So supplement suppliers with these minerals, they don't treat. That is the main thing I'm indicating, but they provide those the minerals and all that the body needs, all that the prostate needs. And in most cases, when we give you those supplements, we are just adding on, but we are not treating. We are adding on so that we can prevent. As prevention is better than cure. Now, when we look at these many supplements that are on market, many come with lies, many come with even false information. But then how do you clarify and find out Most times when people go to media, TikTok and all that, they find out that they are looking out for what is the best supplement for my prostate, what is the best supplement for my joints. And at the end of the day, you come to your pharmacy and you are just very specific. I need this specific supplement because a TikTok video say it so, or because the paper you read say it so, or because of what, and so many things. And when we ask most clients, what is it? What are they using it for? Some will tell you even a reason they are not supposed to be using it for. So it's a challenge in community practice. It's a challenge for pharmacists and dispensers who are operating with these drugs. And at the end of the day, we are looking at, do these supplements work? And if they work, are they safe for the patient or are they safe for you? So in that case, when we look at all the things, let's know if they are working, that is effective in what they promise to do, and are they safe. So at Spring Pharmacy, we have a list of supplements that someone can use in order to prevent these conditions that can come in a later age as related to a prostate gland. Now, the risk factors mainly for these conditions is the diet, alcohol use, smoking, obesity, chronic conditions like hypertension, diabetes, and many others. Mostly the one I wanted to concentrate on is ethnicity. And Africans have a higher chance. Mostly studies show that they are 4 times more likely to get prostate cancer. Because the reason is with age and with the foods that we are eating these days, and then they are not supplying the zinc that is needed by the body or that is needed by the prostate gland to operate very well. And at the end of the day, we have these issues, the enlarged prostate. Now, the word hyperplasia means enlarged prostate. So those are the risk factors that you need to concentrate on. And then another thing is the geography. The places we are in, the food we eat and zinc levels have reduced greatly and affecting the zinc levels, leading to prostate issues. So mainly that is what the risk factors that we have. And if someone, we are telling you risk factors, it doesn't mean these are causes, or it doesn't mean that if you're experiencing going through these or having those issues, the factors we have listed, doesn't mean that you will get prostate cancer or BPH or anything. It just means that you are at risk to heading to that state. So we provide these supplements to support the body. We provide these supplements as a top-up. Yet the main source of getting these minerals are the foods we eat. So you make sure you are very keen on the diet you are having, very keen on exercising, reducing that body weight, so that we deal away with these risk factors mainly. And then another thing I wanted to talk about is, before we take these supplements, make sure they work, make sure they are safe by consulting the pharmacist, consulting the dispensers, and make sure you don't just get something on media and then you're like, let me do this. Make sure they are safe. And if they are safe, they are good for you. And in that case, there are so many on market currently. Others are false, others are okay. And if you're picking your supplements, pick them from a pharmacy. Most times, if you get on a TikTok video and then it's telling you come to this other shop or come to this other place, and you're not sure of their effectiveness, it may again cause more issues than it should be. So your supplements should be gotten from a pharmacy, and then you have to be very sure by asking questions also on your pharmacists, asking questions on your dispensers on how they are safe for you. Because at the end of the day, safety is very important for you, the patient, and also for the pharmacist, for saving lives.